My name is Darren Kies. I'm an interventional radiologist. I'm the chief of interventional radiology for a private practice group called Piedmont South Imaging, and we provide services to Piedmont Fayette Hospital and Piedmont Noonan Hospital in the south and southwest metropolitan area of Atlanta. So this is a common question that we get from patients. I have cancer, but you want to get all these CT scans and I'm getting more radiation. And what if that causes another cancer? And that's a very, very understandable concern. But it's important to put that concern into some context. And admittedly, a lot of this science is a little bit of estimates and population-based studies. So there's a little bit of hand waving involved. But I'm going to answer it with some numbers that will hopefully help patients understand this problem a little bit better. We all know that radiation can cause cancer, but generally those kind of events are very high doses of radiation that are received over time, not the lower doses of radiation that you receive over a very brief amount of time during a CT scan. Once you get diagnosed with a lung cancer, you are going to get some CT scans, and you're probably going to be, depending on how things go and how long you're being followed for, you could end up at some point getting a CT scan, every year for the rest of your life. But the overall risk of getting a cancer, getting a radiation-induced cancer from a CT scan is estimated at something like 1 in 2,000. Okay, whereas the overall risk in America of a person getting diagnosed with just a natural cancer that could lead to a fatal cancer is almost as high as 1 in 5. So you have to understand that cancer is a very, very common disease that a lot of Americans unfortunately pass from, whereas the statistical likelihood of getting a radiation-induced cancer is exceedingly low. So even if you're having multiple CT scans over time, each one of those scans you can think of as 1 in 2,000 chance of cancer, and then you add it up, and then you maybe have a 2 in 2,000 chance. You don't get up to that 1 in 5 chance until you've had almost 500 scans, which most patients aren't going to undergo that much cross-sectional imaging in a lifetime. So I think overall, it's not something that you have to be overly concerned about. Of course, those are always good questions to ask your physician if you have concerns. And one thing for the patients to remember is that CT technology is always evolving, and as the technology gets better, the doses get lower. There's all of these dose, control mechanisms put into place to a CT scan so that you can achieve adequate diagnostic imaging with as low of a radiation dose as achievable. That principle is called ALARA, as low as reasonably achievable. And radiologists take that very seriously. The manufacturers of these devices take that very seriously. So I think overall, it's not something that patients really need to be concerned about, but it is a very important question.